Thank you. Thank you so much. Cheers. To yours as well. You're safe now. Oh, I see. Because I got a jab. I was testing it for the nation. And it's safe. They've spoken about the devastating effect that this pandemic has had on our economy, on our society, and our people's livelihoods. That is why the vaccination program that has now gotten underway remains our immediate priority, starting with healthcare workers and then expanding further to reach population immunity in the shortest possible time. Yesterday, this great and hopeful nation, devastated by a deadly pandemic, lifted its head, straightened its back, and welcomed a new era in our fight against the pandemic. Less than 24 hours after the shipment landed of the virus, the first COVID-19 vaccine, the first COVID-19 vaccine was administered in our country. Our vaccination program, which is our best defense against this pandemic, has begun. Yesterday, when I went to Khayelitsha Hospital, it was like clockwork. The health workers have been well trained, the same at Steve Biko in Gauteng. Health workers have been trained, they are prepared, they are ready to administer this vaccine. And we've been hearing doomsday stories that there's going to be chaos and collapse and everything else. Pause for a moment, South Africans, and look at our capabilities. We must support the commercialization of the products that come from this innovative fervor that we have seen coming through during the COVID period. It must lead to creating factories and manufacturing, as well as creating jobs. I've asked the Minister of Higher Education and Innovation to put together a team of scientists to begin the process of developing our own vaccines so that we can deal with this pandemic and future ones. We now live in an era where pandemics may become more frequent in our lives, and we must therefore be resilient in relation to diagnostics, therapeutics, as well as vaccines.